it was kind of a light bulb moment for me. I just kind of thought about environmental factors as a determinant of health. I felt like the medical community really didn't talk about it that much, or it wasn't something that was really highlighted. And so I began a journey at that time to kind of do my own research around the topic and start learning about it. And I ultimately decided to focus on respiratory conditions because, obviously pollution and pollen and weather are, the impacts of that on a respiratory population are pretty apparent, right? And then also I realized that the disease burden is pretty significant for patients, for family caregivers, and on the healthcare system as a whole. But ultimately, I did not have necessarily a family member who had asthma. But what really moved the needle for me from a passion perspective was an article I read that said that doctors were trying to pinpoint the cause of an asthma attack after a 15-year-old girl had had a traumatic event. And the nonchalance of the title of the article really kind of struck me, because when you read the detail, this young person was actually basically was down for 20 minutes, obviously stopped breathing, and she's now traumatically impacted. She's a paraplegic for life. And so it just kind of struck me as, determining triggers after the fact is really not what we're really trying to do. We should be trying to pinpoint triggers ahead of time and really preventing asthma attacks. So that really is the source of my passion, and it's why I'm driven to kind of ensure that one life breathes easier.